Hi everyone, welcome back to my channel. My name is Gemma in case you're new here, and today I'm filming my kind of like part 2 / follow-up to my breast reduction story that I posted like 6 months ago, something like that. In the previous video I mentioned that if you guys wanted a second video about post-op and pre-op tips, to let me know, and a lot of you requested it. So yeah, welcome back. Let's get into it. I really want to make this video shorter than the last one, which was like 25 minutes, something like that. I have made a handy dandy list right here. So I'm first going to talk about the pre-op and then the post-op. I also just wanted to mention that I won't be showing scars or going over my experience in detail in this video because I already did that in the other one. So if you are more interested in the experience part of my story, go check out the other video. It'll be linked. Okay, so one of my most important tips for pre-op, so before you get the operation, is to have a healthy lifestyle. So obviously, well, most likely you're not gonna get your surgery date like the next day to your consultation date with your surgeon, so you'll typically have a few weeks, maybe a few months between both dates. Generally speaking, there are a few things that you should really do in order to optimize your recovery. So being healthy before getting the operation, meaning no smoking if you smoke cigarettes or anything else. So if you want your scars to look minimal and heal properly, I would definitely suggest taking that tip up. It's only a month, maybe a few weeks of your life, and either way smoking's not really that good for you, so it's always a good opportunity to quit if that's something that you want to do. Another part about being healthy is just to be in good shape, because your body is going to go through a lot of stress during this operation. You know, I'm sure you're familiar with how it goes, but this whole part of your body is opened up, right? It's cut open. So you need a lot of energy to be able to stick those back together. So this goes through eating healthy, right? You want your body to be fueled, to have enough nutrients to be able to properly recover. So I would just suggest, you know, not going on a drastic diet, but just maybe incorporating some more fruits, vegetables in your diet, and just eating better overall before your operation, just to give your body the tools and the energy to help you recover as best possible. So this has nothing to do with losing weight or looking a certain way. It's purely about getting your body the energy and the nutrients that it needs. My next tip is about your hospital bag. So definitely take with you easy to put on clothes, meaning zip-ups, maybe a button-up shirt, or just like a really loose t-shirt or loose sweater that you enjoy wearing. I believe, yeah, after the first day or two, I was allowed to put like regular clothes back on. I didn't have to keep on the hospital gown, like operating gown. This can depend obviously on the length of your hospital stay and what hospital you're going to. Definitely suggest things that are easy to put on. It is it's honestly impossible to put your hands entirely above your head when you first get this operation done. Your range of movement is really limited, so you really want to wear things that are very loose, very comfortable, very easy. Also things that are easy to lift up so that the nurses or doctors can check on your scars and bandages while you're in the hospital. Some other kind of shopping tips, I guess we could call them, before you get the operation done is to shop for some good soft bras. Those are great for post-op. So I didn't have to wear a surgical bra, but after a few weeks I did want to have a little something just to protect them, and also I wanted to have a little something to soak up the oil, because after a few weeks you're going to use, you know, bio oil for the scars, which I'll talk about more in a sec. So my third pre-op tip is, as much as you can, this is really difficult for some people, but train yourself to sleep on your back, because the first few weeks, even almost month, maybe 2 months even, it's going to be really uncomfortable and actually kind of dangerous to sleep on your stomach or on your side. So make sure you're comfortable laying on your back. Maybe invest in like an extra pillow to make sleeping on your back as comfortable as possible. And this brings me to my fourth pre-op tip, which is if you're going to be recovering mainly at home. So I'm saying like you just get the operation and you walk out the same day. I stayed at the hospital for almost a week after my operation, so this wasn't as necessary. But either way, you want to make sure that your bed is as comfortable as possible. So biggest thing is that laying all the way down is going to be really painful as well, because it's like being completely flat on your back is going to pull on your stitches at first. So you want to make sure that you have enough pillows to sleep on an incline. So I watched some YouTube videos about this topic where women actually like rented hospital beds at their house. I live in France where you can just stay at the hospital, so that's not necessary. It's kind of extra, but if your insurance plan doesn't cover staying at the hospital but covers getting a hospital bed at your house, I mean, go for it. It's the best thing. And my last pre-op tip is to pack snacks for the hospital, because if you're staying in the hospital more than like a day, you're going to be eating a lot of hospital food, and it's really nasty in any country. I'm pretty sure that's just like a given. So I would suggest, yeah, bringing a few snacks. You're not going to have a lot of appetite, so it's important to have like food that you will want to eat even when you don't have an appetite. I lost like 2 kilos or 3 kilos, which is about 6 pounds, just staying in the hospital for a week because I couldn't eat from the anesthesia and just from the poor quality of the food. Like nothing made me want to eat. So yeah, snacks is really important. Okay, now for part 2, we're gonna talk about post-op tips. So one of my biggest post-op tip is that if you have the possibility to stay in the hospital more than a day or two, do it, because it will just make your recovery so much easier. Being your medical staff, having the hospital bed, as I was mentioning earlier, all these things will just make it a lot easier. And I know, like in my house, for example, we have a lot of stairs. There was no way I was going to be making it up the stairs the first day. But anyway, yeah, stay in the hospital as long as possible, given, you know, your financial and insurance situation and all of that. So my second post-op tip is, again, concerning your hospital stay, but it's essentially get friends to come see you. I did not want my friends coming to the hospital. I don't really know why. I don't remember why. I just didn't see the point at the time, and I was kind of like, no, I don't want to see anybody. Like, I'm in pain. Like, my mom came to see me, and that's about it. But once I got home, about a week later, my friends came to see me, and I felt so much better. I was getting a little bit depressed in the hospital, so definitely, yeah, get some friends, family to come see you. It really does lift your spirits. My third tip is regarding bandages. Let me go get them. So I'm obviously not sponsored by this brand of bandages. I just thought they were really great and my surgeon recommended them. So if you have the possibility to get them or ask your surgeon about it, definitely recommend. So basically, these are them, and I'll just show you. Essentially what's great about them is that they're transparent. So they're not like those old bandages where it's like fibrous. It's essentially kind of like, so you can't really see, because I don't want to waste one in case I ever need these again. But so as you can see, like, this is long, so I would essentially put one like that and then one here. So I would use 2 at a time, and then I would cut a big one in smaller pieces and use it for the middle part here. And yeah, so they're transparent, which is amazing because, making a lot of noise, which is amazing because you can see like your scars through them, so you can see if there's anything bad going on during your recovery. So for example, I had a little problem where one of my stitches, I think it got like a little bit infected, so I had a big bruise forming that was making like a little blood pocket basically. And so I saw this through the bandage and I was like, what is that? So I called my surgeon right away, and I was able to go back and see her. This was like maybe 2 weeks or 3 weeks after the operation. So yeah, so the transparent bandages, lifesaver. They're also kind of tacky, I guess you could say. It's hard to describe. They're kind of like those band-aids that have like the ointment in them. It feels like that, but there's no ointment, obviously. So if you can get those, they're great because there's no fibers getting into your scars. It doesn't hurt taking them off. This doesn't pull on your skin. It's really amazing. Other than the bandages, I think that's my fourth tip for post-op is to not rush your recovery. This is so important. I know how tempting it can be once like you start to feel a little bit better to like go back to the gym or go back to like an active lifestyle. When you first get your reduction, your scars, even though they're starting to form right and your skin's closing and healing, they're still really fragile. So even if like you feel like you have more mobility in your shoulders, you can move better, you should really baby yourself. So really take your time. When I got this operation done, I was someone who was going to the gym like 5 times a week. I was extremely active, and to be honest, I was a little bit scared that if I didn't go to the gym every day, I was going to gain weight or lose my progress. I was still kind of in like slight disordered body dysmorphia place. So it was really stressful for me to not go to the gym right away, to not run around and do a million things. But it's so important for your recovery. And this also applies to like around your house. Like if you're living with your family, let your siblings or your parents take care of the laundry for you. If you're living alone, get a friend to come over and help you with laundry and just like household tasks if you can. Essentially, make sure you have help at home and take your recovery slowly. But that being said, don't feel that you can't go outside and take a walk. Light exercise is really important as well for your recovery, because you want to keep the blood moving, right? You don't want to be lying in bed for a month, right? That's not necessary for this type of surgery at all. You will start feeling better honestly within 2 weeks, but it's still important after the 2 weeks to take it easy. Then, so my 4th or 5th tip is to not be scared to call your doctor once you're out of the hospital and things are going better. I know like maybe you'd want to think, oh, like it's nothing, or I'm just gonna bother my surgeon with something that's like silly, they'll go away. Don't do that. Go right away or call them right away and tell them what's going on. Regardless of the country that you have this operation in, you're probably paying a good amount of money, so use your resources as long as you can. So you will obviously have post-op appointments with your surgeon, but between those appointments, if something seems to like not feel right or is getting hot, that's often like if one of your breasts is starting to get hot, that's a sign of infection. So look out for those signs of infections, and yeah, don't be shy. So one of my recovery tips that's more of a long-term recovery tip is about oiling your scars. So essentially putting scar serum. So yeah, so you want to be using a scar serum. I've heard vitamin E is really good, or you can also just use a moisturizer. My surgeon said a moisturizer is fine. So this is obviously once your scars are like closed completely. So it could be a month or 6 weeks. You have to check with your doctor before doing it. If you start putting cream and stuff on your scars when they're not ready, it'd be a disaster. You can get infection and probably hurt a lot. Like, just don't do that, right? It's like if you had a scrape on your arm, you wouldn't be putting moisturizer in it, right? No. So I personally used bio oil. I used my bio oil from, well, let's say about 1 month post-op until like 10 months later. I used it really honestly every single day for 10 months. At the first, obviously I did it morning, I think I did morning, noon, and night. I did it like a lot during the day, because at first your scars are, healing, but once they start healing about a month later, they get kind of flaky, like you get a crust going. It's kind of gross, to be honest, but in that crust phase, that's when you can start moisturizing, and that's when your skin is kind of dry, right? Like it's flaking off. So that's when I started using it more generously. Then obviously, over time I was in college as well for like 4 months of that, so not every single night of college I moisturized correctly. Still, I would suggest doing it for at least 6 months, if not more. It really helps. Even now, so now I'm like 2 years post-op, after I take a shower, I'll like put some moisturizer on the scars. Not as systematically as I used to, but I still do that just for good measure, and also it's part of my body that needs to be moisturized, right? Skin. Okay, and my final tip for you guys is about sleeping. I still sleep with what I call a sleep bra. So essentially it's the same thing as the soft bras that I was talking about before. I just like to wear it because maybe paranoia. I'm just like, I don't want anything bad to happen to them. I don't wear it every single night, but at least a few times a week I will sleep with like a little sleep bra on. Obviously that's completely up to preference, and it's also up to the size that you're gonna get afterwards. I'm a C, so as you can see, like they're obviously much smaller than they were, but they're not tiny. Like I'm not an A cup or a B cup, so I just like to wear a sleep bra every once in a while just to make sure everyone stays perky and nice. So that is all my tips for you guys today. Let me know if you have any questions in the comments below, and if you want any more breast reduction content, yeah, leave me some questions. I'd love to help more people out with this. It's truly a life-changing experience, so I would obviously highly recommend anyone do it that feels that they need to have this done. Let me know if you're getting one done. I love to hear about other people's recovery, and if you have any like questions that you don't want to put on YouTube, you can DM me on Instagram. I always link my Instagram below, but it's Gemma Carey. Hope you enjoyed this video, and I will see you guys soon. Thank you for watching.